because Behringer is there and Behringer pretty much buys in, Jared will sweep from his nuts as much as he can, so probably.
All right. I mean, Jimmy too, for that matter, right?
Yeah, well, Jimmy's his own guy anyways. You know, Jimmy does what he's got to do, so you don't have to talk much to Jimmy. So, yeah. I think Jared will just see.
Oh, but I like the helicopter in the background.
Sorry about that. I'll put it back.
Yeah, it's so pretty. If you ever want to get rid of one of those, I'll take it off your hands.
Yeah, they're tish expensive.
I want you to give it to me.
The problem with getting an elephant is someone has to feed it.
Well, that's true. That's true.
The Fenestron would make a hell of a ceiling fan, though.
Okay, so it's 3 o'clock, so I guess we'll get started. It's a few people filtering in, but initial part don't need too many. So can I get a motion to approve the meetings, the meeting minutes for those who have read it?
I make a motion to approve.
So moved.
So I got Ushkow, and who was the second?
I can second.
Okay, and just double check, do we have, got Bruce? Mike, Rob?
You don't have your camera on? No? I can put it on. Oh, you don't have to. I just want. Yeah, go ahead.
Yeah, so we've got a quorum since.
I'm here.
Mike doing double duty with 2 people for him. Okay,
Rob,
so we definitely have
I'm here with Frank. Rob, can you hear us?
You.
Okay, all right.
Yes.
Join's done.
Okay, so first just have to read in the disciplinary findings. Christopher Foy from Central Square, New York. Certification suspended for 1 year. Suspension stayed pending further violation. Also civil penalty 2,000 for violations of part 800.15 and 800.3. Newark Arcadia Volunteer Ambulance had their certification suspended for 1 year, effective 12/22. Suspension stayed pending full service investigation for 3 years, and they were assessed a civil penalty of 5,000 for multiple violations of part 800 and PHL A30. Okay, with that, moving into reports. Can you get a report for the Operations and Academic Committee?
Okay. Well, we met obviously earlier today. Most of you guys were there. Part of this will be actually kind of a CMAC update too, since there were a number of modifications to protocols. First of all, the Tylenol protocol was changed as everybody was having trouble drawing up 20.3 milliliters to get to 650. So it's now 640 milligrams. There was the addition of TXA, as Mike pointed out, also the possibility of blood transfusion if a agency is so approved. Also was the addition of patients self-administering inhaling isopropyl alcohol for treatment of nausea, which should help with nausea if we don't want to use Zofran.
Actually, there's clarification there, Don. That would be an alcohol wipe, not a bottle of isopropyl alcohol.
Yeah, we're not doing the whole bottle. And
Yeah.
I guess you could always end up using your hand sanitizer as well, assuming it's not coming from outside.
I don't know that anybody's done that study, but I think we've got a study that we can do there.
But isn't the hand sanitizer ethyl alcohol, so you have to completely start from scratch?
Well,
That is true.
possibly. The other question is what happens if you inhale the New York State hand sanitizer, which actually may make people more nauseous.
Yeah.
I know people work at the prisons where they made. You don't want to know.
So let's just stick with the alcohol wipes. That'd probably be the best way to go. Excited delirium, just recommending, which is already being done, end-tidal CO2 monitoring if people have been given medications for that. Let's see, again, just suggesting, and is already being done, a viral filter with all Supergato airways as well as ETPs. And there were some additions to CMAC as far as Finger Lakes has specialty care transport protocol. New York City wanted to have the addition of being able to adjust the size of their needles for their vaccination pods as they were having difficulty getting the appropriate needles to do the immunizations. And that would be the end of CMAC and part of the academic. There was also a discussion of people in vaccination pods wanting to go out into the neighborhood and be able to vaccinate shut-ins. Bit of a discussion on that. We do have Mike sent off what Ryan had requested. It is rather lengthy. If anybody wants it, Mike, you can send it off if you want to them on the requirements to do that. When I spoke with Ryan, he basically just requested a letter stating that you wanted to participate in a community paramedicine program to be able to do out-of-pod COVID vaccinations, but didn't list all the things that are in that list. Hopefully that will get cut down too, as we really want folks to be able to do that. There was some discussion on not being able to get vaccine, as I think all of you are well aware, there's a considerable shortage. And a number of pods have requested medications, but they're not getting any vaccines.
Don, sorry to interrupt. Just going back to the community medicine vaccinations. Is that for ALS agencies only, or can BLS get involved in that as well?
If you're out of your pod, it's only paramedic that will be able to do those things.
I think actually the clarification is there's two different things, right? The first is whether or not EMS providers can vaccinate, which was clearly delineated in an executive order that they can. The big question that becomes the issue here is actually what supervision means. So if you go back and you read Article 30, it says that EMS providers act under the supervision of a medical director. That's actually the exact same language that's quoted in the order that allows EMS providers to vaccinate. Now, the sticking point seems to be whether there needs to be a licensed person actually physically there while EMS providers are doing that vaccinating, and what that supervision will ultimately mean. Community paramedic programs who are allowed to vaccinate without that licensed provider there are the ones that have the long list of stuff that Don was just commenting on. And the community paramedic programs may only be done by paramedics.
So if you're outside your pod, only paramedics will be able to administer the vaccine. If you're in your pod, EMTs can do so. Although so far what we've been doing with the sheriff is having the EMTs supervised by paramedics. We're not there by themselves. All right, moving on. Remo has an EMT course starting March 1st. Albany County is going to have a very concise and rapid EMT course that will be starting in March as well. Gilderland has one that's starting very shortly. It was suggested and that we include the vaccination training in the EMT programs. I think everybody's going to be doing that. It's only a couple of hours worth of training. We might as well train them while they're still in class. Paul Segru mentioned the fact that if you want to join Hixney, there's a fair amount of money to be obtained. However, as Jay pointed out, the contract is 120 pages long. So you'll probably be using all those funds to pay for your attorney to review the 120 pages prior to signing. But it is available. And that's basically it from academic.
Okay. So next have the REMSCO report. So good news is most of the money that got held back due to the pandemic, it looks like that is getting released to us. So the REMSCO itself will be in a better financial situation. We're replacing fluids for the electrostatic cleaners at most of the hospitals. And we also decided to add one to Ellis because the UV light that had been, oh, I'm muted. Nope, I'm not muted. The UV light that had been used there has basically been beaten up and destroyed. Also, we have new delegates from Saratoga, Tracy Weir and Doug Bauer. And the elections were held for officer positions, and Jim Stairs is replacing Steve Kroll. Scott Bowman has moved to vice chair. PJ Keeler remains as the treasurer, and the secretary position vacated by Scott Bowman is now open. Anything from QI, Deb?
No, Rob, Deb's not on. Her husband had eye surgery this week, but QI was canceled this month.
Okay.
The only report that we have out of QI actually is that standing ketamine report was done, but we did not get down to the granular areas, which we normally would, just because of other requirements on time. But we used ketamine 16 times, and the documentation seems to be pretty good. Just one or two cases we need to take a closer look at. There were no complications.
Okay. So Hawk was canceled. Agency updates. Malta Stillwater is going to EMS charts. Other than that, there's no other updates. Public access defibrillation. EA Collins Construction in Rotterdam. EBL Construction. Capital District Juvenile Secure Detention Facility, and Stuyvesant Falls Fire Department. New business. Mike, did you want to talk about the guidelines for provider exposures?
Sorry, Rob, I didn't hear you.
Did you want to talk about the guidelines for provider exposures?
You want to highlight it?
I'm not really part of the waiver process, so I couldn't really speak to the details other than it requires a lot of testing.
I think the only thing that's important is provider exposures will continue to be managed at the level of the Department of Health, at the local departments of health. There is no waiver that seems to be working for EMS providers that we have seen, and as a result, we have As a result, we've got, you know, providers that we're going to be losing on a relatively regular basis. The only thing that's a big advantage right now is the numbers are decreasing enough that it's much less of a concern. As of today, there were under 450 positive cases in the hospitals of the Capital District, which is a significant decrease from just over the course of the last week or so. So I think we're heading in the right direction too, in spite of some of these complications.
Okay. So
The bus and
COVID
have
and
Mr. Finn hanging out the side window.
What's that? Okay. So COVID in the region looks like it is trending down. There are about 450 patients hospitalized in the region today. That's down from earlier in the week. Concern is with the new variants, if we're going to end up with like a bimodal peak versus this kind of just trending down because we're done through the holiday surge. We're going to see where things are going with this, but the hospitals definitely look better off than they were earlier. But this is still going to be a long process. This isn't going to be a week or two when we're out of it. Okay. It's a light agenda for today. So does anyone have any discussions for the group? One question, chat.
Rob, just confirm our next meeting.
Next meeting will be April 1st Wednesday. I don't have the date in front of me.
Okay. I just want to confirm it's April and not March. That's all.
Yep, we're on the even months.
Yep.
Until the fall when we switch over to the odd months.
That'll be April 7th.
Thank you.
Rob, did you arrange the Uber Eats for the next meeting?
Yes. Your doorbells haven't rung yet?
No, not yet.
Okay. Must have missed you.
I don't think we'll be in person yet. No.
Okay. Can I get a motion to adjourn?
Motion to adjourn. So moved.
Thank you very much. We'll see you then.
All right.